So hello everyone, good afternoon. I welcome you all to the Homeopathy Musings. Before moving forward to our today's session, let's have a quick look at our upcoming modules. So we have this ongoing course that is from classroom to clinic. It is a 6 months course which is specially designed for students and early practitioner. The aim of this course is to strengthen the classroom basics via mentoring sessions, via hand-holding case exercises. And with the perks of this course, you will get a complimentary Synergy software, a full utility trial version for 6 months. The course is already started in March, and if you want to register, you can register now. And the recordings of the previous session, which you have missed, you will be provided to you. Then we have another ongoing course from that is Animal Series, which is a 1-year course. The in-depth course about the animal kingdom. There will be total 8 groups covering of the animal kingdom. We have already completed insects and spiders, and the upcoming session will be on sea creatures and crustaceans. If you want to join, you can register soon. The recordings will be provided. Then we have a very clinical course on the cancer management by Dr. Ajit Kulkarni sir, a renowned homeopath. Sir will be giving an in-depth learning on the cancer management through homeopathic perspective. There will be total 8 sessions on Fridays and Saturdays in the month of April. First session was yesterday. It has already started, and you can register if you want, and recordings of the yesterday's session will be provided. Then we have another interesting upcoming course on the autism by Dr. Aradhana Chitra ma'am. Ma'am will be taking the sessions on understanding of autism through contemporary concepts of homeopathy based on the inner age, based on the PM model and sensation method. There will be total 4 sessions in the month of May. Please note that the early bird offer is going to end soon, and you can register soon if you want. Then we have a another upcoming course on the solves of row 1 to 4 of the periodic table by Dr. Shekhar Algundi sir. There will be total 4 sessions in the month of June. This 4 sessions will be moreover focusing on the remedies, which are the solves from row 1 to row 4. There is another clinical course that is managing gynecological complaints with homeopathy by Dr. Gajanan Dhanikar sir. There will be 2 sessions on the 5th and 6th of July. Early bird is still going on, and you can register if you want. And another very interesting course on the matrimonial remedies by Dr. Gharsham Kalathia sir. Sir will be taking in-depth understanding of the matrimonial remedies. Sir has already taken on superficial understanding of the matrimonial remedies and use in our homeopathy musings in our previous sessions. There will be total 8 sessions. The course will start in August. Registrations are going on. And now, on the occasion of World Homeopathy Day, we are very excited to announce a special discount on our musing platform, where if you register any of the 2 upcoming courses together, you will get the 3rd course for the free with no additional cost. And another offer is we are excited to offer 10% discount on each of our plant, animal, and mineral kingdom courses, where when you register all of the 3 together. If you have already registered for 1 course, you can, and you want to sign up for another 2 separately, then 10% discount still applies. Then going forward to our today's session. Our today's session will be on Pillars of Pediatric Practice by Dr. Sheetal Bidri ma'am. Let's go through our ma'am, like today's speaker. Dr. Sheetal Bidri ma'am, a passionate homeopathic pediatrician and a holistic health practitioner with currently practicing in Bangalore for more than 10 years. She is very passionate in learning and teaching homeopathy in depth, sharing experiences, and motivate younger and fellow homeopaths and break myths of homeopathy. She strongly believes in bringing up healthy children with the right nutrition, right lifestyle choices, and diet for better immune system through their adulthood. So ma'am will be taking the session, and we are very excited to hear from her. So before going forward to our today's session, let's have a quick look at basic hygiene factors. Mute your lines all the while as it will be distracting for the speaker. Keep your videos on, which helps in introduction and avoid temptation to multitask. Raise hand while the speaker is explaining. All the questions and comments will be addressed at the end. Please do not scribble as it will be very distracting for the speaker. Most importantly, make notes and share your experiences and enjoy. If you have any doubts or difficulties, you can just contact on this below numbers. Now, without taking any more time for with our today's session, let's going forward and we'll hand over to ma'am.
Good
Stop
afternoon.
sharing.
Thank you so much for giving me this platform, Homeopathic Musings, Dr. Preeti Shah, and even Healing Harmony, if I'm not wrong. So thank you so much, Dr. Mansi, for an introduction. And I love the fact that you encourage the participants to keep their videos on and be mindful about it. So the first thing I would like to do is um, give yourself this 1.5 hour to 2 hours. I will try to keep it 1.5 hour, provided you give me that complete 1.5 hour or 2 hours. Okay. We'll see how your energy levels are there in the room, and then I will judge if I want to continue it even after 2.5 hours. Let's see. So we will try to do only one thing at a time. I know a lot of you are in clinic and you're trying to listen. If you're multitasking, then it's better to keep your video off. But if you are able to give whole and soul energy to the session, nothing like it, because being mindful would be the best thing you can give yourself. Um, I would like this session to be a far, interactive session, so that we can share our experiences also. Because I whatever I am today, or I little that I know about homeopathy is because of discussions and reading and groups like this, which encourage learning on day-to-day basis. So without much ado, um, is there a possibility they can unmute and talk, or they chat, or how do you do it, Dr. Mansi?
Yes, ma'am. If they want, they can raise hands and we can unmute them.
Okay, I'm just gonna share my. I think this is the audible. I mean, visible.
Yes, ma'am.
We go full screen so that. So I'm okay with whatever participants like. I am used to interacting on the chat box. If you feel, just a second. No problem. Sorry. Is it still visible?
Mm, no, ma'am.
Just a second. I'm so sorry. Just did it 2 minutes back. Obstacles to cure. Just a second. Let me stop share and do it again. I'm so sorry. I'm really sorry. I just finished this one.
Ma'am has not started. Dr. Vidya, please wait.
Yes. Thank you guys for being patient. I'm just logging in. So meanwhile, let me just have a chat with you guys about do you face pediatric as one of the most challenging cases, or it's very easy for you to take care of your pediatric patients? Should I go to the chat box for discussions? Is the voice audible? Unable to hear.
Yes, ma'am. Now it is audible. Before it was somewhat cracking, but now it's okay.
Now it's okay, right?
Yes,
Okay.
yes.
So
Yes, one of the doctor is saying it's very, very challenging.
challenging.
Yeah.
What is the challenging part in pediatric practice? What is, so that even I should know what some you would have registered to today's session because you want to know about something and then get to this, right? So when you say it is challenging, what is the main thing which we have problem in, or we find it little difficult in? And there is no subjective symptoms. Okay, then it's tough. Okay, then what else? But there's something else, no? There's gold, that is the objective symptom. So you can never go wrong with pediatric cases. Case taking. Case taking is one of the most difficult parts, right? So I still remember when I was doing my master's in pediatrics, one of my senior was too kind enough to to take a complete session with us, because they were the first batch, and after that we were the only ones, and we were so clueless. We go to the pediatric department, everybody's crying, everybody's shouting, everybody's like all over the place, because we have a small OPD in our college, and everything is in that one small area. How do we handle it? So the first thing first is that our case taking needs to be very strong, right? Another one is to avoid interpretation of parent in presenting complaint and parental anxiety. Very true. I think somebody has really, Dr. Arpita and Kusum. Parental anxiety. So today, I mean, parental anxiety is a completely different topic we'll have to address, in depth, because what the patient might be feeling is completely different from what the parent is complaining to you. I still remember a case of, you know, I've been giving this child for fever. I've been giving this child Heparsal and Silesia, thinking that wants covering and it's wants to be wrapped up and everything. But then I when they came to the clinic, it was an online case. When they came to the clinic, the child was very restless, and then I've just made her to remove all the extra clothing that the child was having, and the child started feeling comfortable. So the mother was feeling cold. So the symptom I had taken is wants to be wrapped up, right? The mother is feeling cold, but the child is so hot that he it cannot tolerate the clothing at all. So not just the parental anxiety, the parental interpretation, depending on their sensitivity, is a totally different topic altogether, right? So that is another thing. So avoiding interpretation, don't get complete symptoms, case taking, subjective symptoms is tough. Then getting characteristic symptom is difficult. No symptoms to explain. You will not get a LSMC situation here. LSMC तो भाड़ में जाए. We will not know यहाँ पे ही दुख रहा है. No, it's not gonna be that easy as the thing. But because we are not gonna get so much, no, it becomes very easy. Becomes very easy to prescribe, because it's just ये है तो है, ये नहीं है तो नहीं है, बस. It's just white or black. There is no gray area, right? So today I want to address all of that, right? So what if I tell you that end of today's session you'll have uh, you know some hint to what you should do in the clinic when the patient comes, or a pediatric patient comes to you? How does that sound to you? I just want to ask you the question because I want to see that if everybody's awake, because it's peak lunchtime and it's very hot in Bangalore, and I don't know where we are all joining from. So I want to see some answers in the chat box. What if I simplify just case taking today? Just case taking. So we do know that we have so much exactly. Okay, we have somebody's awake, somebody's there. That would be amazing, very helpful. Okay, good. So I think we are all jazzed up for the session now. So the reason why I took up the topic as pillars of pediatric practice is because we need some pillars to lay our whole analysis in, right? We need something that helps us to stand on the banks of these pillars to give our prescription, our advice, our a follow up, the prognosis of the case, what can it be, and eventually relieving the child and of course the parents worry as well. So that is why I thought this would be very apt for today's session. If in case you have any doubts, we shall do it by the end of the session. I would suggest you do it on the question and sticker, if there's a question sticker, so that we can address it and we don't lose it in the chat box. So one second. So today's objectives is what are the qualities of a homeopathic pediatrician. Okay, we know we are having a lot of pediatricians in the homeopathic background right now because of the masters being so widespread all through the country. And the main pillars in pediatric case taking, or a pediatric case, if I may just give, not just case taking, but what are the pillars that I want to stress on. There are actually 6 to 7 pillars, but I just summarized to a shorter one so that you don't forget it. So stay till the end and be attentive, because till you get to the last one, you will understand why I have concised it for only few. Okay. Then we'll try to understand some remedies, how they might present in the clinic, how they might, behave with you, how they might behave with the parents, or we try to understand you. Of course, it's difficult to completely understand a child. Otherwise, no child will have any problem, right? The mother will know everything the child needs, right? So also, I will be using a lot of repertory, and how we will be using. I'm using the Synergy Homeopathic software, and if all of those who have enrolled into the 6 months, classroom to clinic, you would be experiencing the Synergy Homeopathic software. So that's a good way to start off learning, and plus they are giving you how to get to the clinic part, so don't miss the classroom to clinic as a course that you have to go to. And then we shall see some of the PQRS, which we can see. Again, mostly it's going to be a fun session. If you want to ask me something, we can do back and forth if you want to. And let's just enjoy it first. Like first thing first was when I asked you if it is challenging. I want you to start feeling that a pediatric case is fun. It's going to be really easy. It's going to be really to the point. So the next time if a pediatric case comes to you, you know what to do, and it's going to be fun, right? So having said that, it's coming half. Is my screen okay?
Hello, ma'am. Your screen is visible only half.
Wow. How does it
Yes.
work?
Like left portion is not visible.
Okay, I'll stop sharing. 1 second. Just a second. I have no idea what's happening. It's the first time this is. Let's try again. Dr. Mansi, just let me know if there is anything
Yes.
in terms of the screen, please, because I can't see anything else. Yeah. Thank you.
Yeah, it is visible now, ma'am.
Thanks.
Perfect.
Yeah. Okay. So clear, everybody? Interaction. Otherwise, both of us will fall asleep. So you should make sure I don't fall asleep. So make sure you are there. Okay, my chat box is on the right side, so every time is I'll be listening to you guys. Okay, shall we go ahead? Dr. Ruchi Kharia is scribbling on the screen. Okay. All right. So coming to scribbling, you know what is a pediatric case in the clinic, right? Have you experienced the scribbling of a child in your clinical setup? If you don't chat on the chat box, I will not move forward. I will keep waiting like this. Only Dr. Arpita is found one. Okay. So what is, first of all, as a homeopath, we are like detectives, no? We want to know kya ho gaya, where was, the child when they did this. We're trying to find out the ailments from, we're trying to find out if there's any maintenance costs. We're trying to find out if there's any parental pressure, parental, involvement. So, yeah, so you will find more than one aspect in any pediatric case. So we have to get our detective lens on and try to go in different aspects. Now, any child will not come to you directly telling that they have a problem. Okay? I just it's the way how we present ourselves as doctors. Most children will have the white collar, that the fear of the doctor in itself, right? So once you change that, kya ho gaya, to, what's up, kya ho gaya, just this one small change will change your whole case taking on, because after the fifth year of the child they are able to communicate what they feel. They are so in touch with their emotions that they can talk to you about it, right? So they can you can tap into different aspects of the child by you being a child as well, right? So one of the main uh, things of any pediatrician, do you, if you remember your pediatrician, wasn't your pediatrician very friendly? He was always warm, will have something, will either give you a chocolate or will keep something candy around, a nice playful thing around you. And you should not be hurrying, like also like और नेक्स्ट पेशेंट देखना है तो फिर क्या क्या हो गया, जल्दी बोलो मेरे को दूसरा पेशेंट है, ऐसे बोलोगे तो आप, it's not gonna do any good. Is anybody okay with me talking in Hindi in between? Do we have a lot of anybody from outside? If anybody has a don't, just write don't. I'm from, okay, done. I will try to be only in English then. Cool. So I'm so sorry. Is there any change in my screen now? No, right?
No, it's
All
visible.
right. So the whole attitude of the pediatrician tends to become very relaxed. So the eliciting of the symptoms become very easy. Okay? Now, coming to understanding in the homeopathic point of view, we know that individuality is by far the most important thing in our practice. We cannot compromise on individualizing, though these children have not yet developed a completely full blown ego of their own. Like I'm talking about the infancy stage or the toddler stage, right? So though they all look alike, they all have the same milestones, same kind of problems. Most of them have colic problems, they have dentitional problems, they have gut issues, they have milestone issues. They might be delaying in their walking, talking. Though they have similar issues and similar problems, they are all unique in their own way. Now, it is your responsibility as a homeopathic pediatrician to buck up and create something that is very essential for you. So the first things first, being the sixth aphorism of of medicine, is the power of being an unprejudiced observer. So here the meaning of unprejudiced can get a little different, because we don't want to get we don't want to get influenced by what a parent might be pushing us to believe about the child. Okay, you yourself have a keen eye. You yourself look at what the child is presenting in front of you. Pick up the child's sensitivity. There was this case where the mother was very critical about the child, and the child did not like it. The child was fuming with anger, and the child was feeling that pent up anger that was going red. The cheeks got red, and it became so much that the child ended up crying in front of me, because the child didn't even speak to me, but just because the mom was constantly giving a history against. So that thing what is what the child was sensitive towards as well. So you need to keep the child in the room while you are taking the case. Some doctors might feel that, you come alone, keep the child at home and come, and then you will take the case. Then we will prescribe according to who he is and what he is, and and then we shall probably meet the child later for the examination part. No, the whole session, sometimes it can get a little too much. Like if there is a 40 minutes or 50-minute session, the child will get restless. So of course you will, any child will get restless, but the restlessness characteristic is something that you can look for. Yeah, how the characteristic symptom points out in the clinic is something that is important. Okay, so what are the exciting factors? Now that can also be seen in the clinical setup, but also in repeated histories. What the child is been going through. Let's say, for example, let's talk about something non-mental. So let's see if in case there was a child who had recurrent pneumonia, and then I get to see that the child's father also has a respiratory condition, and they constantly had something on the other, and they had the same time. Whenever this child has pneumonia, the father also had this allergic rhinitis and sneezing constantly. So I try to understand what was the two times that these events happened together. Give me, go back and think. And then both the times there was this homa that happened in the house. The homa is nothing but a puja where there's a lot of fire and there's smoke and soot in the house. So both of them landed up in the similar situation. So an exciting factor can be very important in the clinic, in the case taking as well. So be it a mental exciting factor, physical or environmental. So anything can be anything can stand out to be very important. Now, also the most important and the most fun part of case taking is the engagement and the reactions. Where I was talking to you about the anger in this child when the mother was explaining. Also, how the child behaves in the clinic. It's so important, right? So, how the child is engaging with you. Is he allowing you to see or hold you? There are children who, even if I'm not even touching them, and then they get triggered. You don't even know what happens after that, right? So all the child is very come auscultate me, see me. I still remember a child who I spoke to the child. Child was so friendly. The child is, I think the child is just 2.5, 3 years when she came to me earlier. And I remember this child being so warm and friendly with me. Let me talk to the mother, did not interfere, kept looking at me, kept looking at everything, whatever I did. And then I thought, let me just see the auscultate her lungs and see if she's okay. And then she pointed me towards the torch, that you didn't use torch on me. And she was telling me to use the torch and show. And it's just that, how they are trying to uh, talk to you or be with you. So that is another thing. Another patient, if I just bring out the torch, they're going to scream, right? So the how the reactions are is also very important, and how they engage with. There was one patient who came in with me where he had so much energy that he had to be channelized into some activity, right? So we need to the mother also knows that he needs to be somewhere. And I am very against my children using phones on in the clinic, because that'll take away my observation skill, right? So one thing, if they get engaged into one gadget, all my observations will be off, because their energy levels are all into that. So I am totally against that. So what I did was I gave them a piece of paper and some color pens to write. And that child was a bit reluctant, but got so excited looking at the color pen. And then the child narrated a whole story that the child was able to write and draw a whole scenario of policemen to be rescued, the ambulance, and there was a whole story. And I sat with the child to understand, tell me what is this story and what is happening. So the case taking can be only this also. So it can be like, tell me what is happening here, and then we shall correlate what are the themes that the child was going. And this child got Nicolum in the end of it, so it was a very beautiful case. So sometime I will share it if time permits, or if that kind of cases come into our future. So yeah, good. Are you guys awake still? We're just starting off. So how many students are, I mean, how many participants are here? And I'm getting only one person to answer. Yes, Dr. Katie. Super. Are you guys awake?
You are interesting enough to keep us awake without tea or coffee.
Oh, that's a beautiful compliment. Thank you so much. I don't know who told that. Yeah. All right, good. So moving forward, yeah, that's the thing, Samsung SM. We have to be patient. We will be patient through our case taking. It's going to be like this only. It's going to be very, very slow with the child. If the child is not going to talk to you only, the main point pe nahi aata hai child. So, you might not get the right point at the right time also. So, be patient. We shall get through the main pillars. What is the first thing you will think of, in a pediatric case taking? What is the main, let's say if you have a toddler with you, and what is the first thing that comes out? Okay, in the pediatric case, I have to take this particular, history. What is that? Everybody and anybody knows. Milestones, actions. Yes. First things first is mother's history during pregnancy, which we will not forget. Yes, Dr. Parul. Now, there is there are two parts in this particular section of this pillar, where it's not just about mother's history during pregnancy. We'll see what is the other part. So first thing is the mother's history during pregnancy, right? So what happened during pregnancy? Why is this so important though? Anybody? Why is mother's history during pregnancy so important? What are the reasons? Yeah, I'm getting some answers now. Any stress, that emotion, that impact that the child has, effects of child development, any stress. Perfect. So what, now how do we, so it's very easy to take the mother's history during pregnancy. You divide it between, antenatal, during pregnancy, and post pregnancy. Okay, first things is before, during, and after the whole act of pregnancy itself. Now, antenatal becomes very, very important in terms of, when there is developmental disorders, when there is a gross pathology that the child has been seeing from the birth itself. In cases of MRCP, that is mental retardation, cerebral palsy, autism, and in muscular dystrophy or any genetic related issues, when there is something that the DNA, while the when the reproduction was taking place, when the multiplication of the cells was taking place, it got multiplied with a gene defect, right? Now, what this gene defect was subjected to while they were in the womb of the mother is most important, right? So that becomes an important point. Rightly said with by all the participants here that the fetus has an immediate response to how the mother feels, how the mother is feeling, what exactly, what emotion is predominant in the mother, what emotion is lacking, or what if the child felt what if the pregnancy itself was unwanted, and those emotions, this particular study was done to see if the hand movements of the child when they were subjected to a clip where it was a happy clip or the sad clip, and only in the happy clip the child was able to move the hands, but not during the sad clip. So there's so many research papers that are supporting this factor of why mother's history is so important, why mother's emotional well-being is as important as the physical. It's not just the immunity shots what they give during pregnancy, or the folic acid or the iron tablets, but also how is the mother given the nutrition to her soul, her mind, her emotional well-being. It was the husband, it was emotionally available for the mother. Sometimes mother-in-laws are not too not too friendly with the mother. These days, girls do not want to stay with in-laws, so purposely they make tantrums to stay away. So yeah, there can be so many reasons, right? And what I call the perpetual mother-in-law syndrome. The either it is the mother-in-law syndrome or the daughter-in-law syndrome. You will never hear father-in-laws and daughter-in-laws having issue, or so it's if you see the in every family, you will find either the mother-in-law will have a problem with daughter-in-law, daughter-in-law will have a problem with mother. So that conflict that keeps happening, that how the mother felt, when they were, I have subjected to cases where the child was, you know, felt very, very, neglected because the mother didn't even give him the nourishment during the pregnancy. The mother didn't want the pregnancy. Mother was forced into the pregnancy, and the child till date, if after birth as well, feels very, very forsaken, and the child is no more a child now. I think he's going into 13, 14 years old. So the child when feels that I'm forsaken, and from starting he would feel uh, the need to be very independent because the parents are not going to give him the nutrition, love, care, and affection. So things can be uprooted from the pregnancy itself, and of course we know homeopathy can help in such situation. And going back in time with the whole garbha sanskar, if you can relate to our in spiritual practice of Vedic times, where it was very, very garbha sanskar is like, it's like sanskar is a culture around the pregnancy was practiced in ancient Indian times, where while the child is in the womb, the priest and everybody would start educating the fetus while they was in the womb, right? So if you have heard of the very famous Abhimanyu effect, the story of Abhimanyu brings back again and again how the memory of him to come out of the Chakravyuh, the fighting situation, was illustrated only in during the while Abhimanyu was in the uh, womb of the mother. And even the Bhakt Prahlad was another example of learning learning to worship Lord Vishnu in the fetus stage. So he used to worship Lord Vishnu from fetus stage because the mother also was, right? So these are some of the examples, and of course, what the mother speak, the what the baby will respond. It depends on how the mother absorbs joy around her, how she is taking, her environment into importance, and then we can do. So that is why it's important for mother's history during pregnancy. And we have so many rubrics that it can, which we can bring into our analysis, or we can use this information. So I know you would ask me that, okay, we are taking this history, but how do we use it in our prescription? Right? So this is the question I faced. There was, and only thing you can do is sit with the Materia Medica and repertory. There's so many remedies out there which will give you hints about what happened during pregnancy, and how it can affect the child. So that is already available in our Materia Medica. Also, we can apply in a way that, when we use the ailments from a rubric, you know that causative factor is so important for that, right? So there are different chapters. We have so many causative factors. Ailments from silent grief, ailments from, silent anger. Maybe the mother did not fight back that time, So if that was very, very strongly felt only, if it was way too strong, then only consider it in your case taking. Otherwise, if it is like this similar thing which did not affect her so much. So how do you find out that it was strongly affected? Ask the patient. Ask the patient, what was your reaction to it? How did you react to it? You will find that if it was too difficult for the mother, they might even go in a situation where they'll terminate the pregnancy, or suicidal disposition, or they would give you various aspects of the chronicity of what they felt, right? So that is the importance. Now coming to what is here's another. Did I go back? Yeah. So if you go into the PubMD and look in for many researches that has been made with maternal emotions and the fetal health, there are plenty of it. Utilize it, learn. Some of them give an affinity towards which emotion to what. So if you're interested, go in and learn as well. Now, I think I've already spoken about this, in which cases mother history is important. That is when there is, firstly, the mother should have felt it very strongly. Secondly, there is structural disturbances, child born without something in person, that cannot see, cannot have a vision, the physiology is affected, the anatomy is affected of the child, the gene is affected of the child. So that becomes very important for the case taking. Now, feeling. Now, another part of it is mother history in general. Now, you know that mother makes a home, right? Mother makes. Now we are the impression, or our we are the mirrors of our parents, right? Or the children are exact mirrors of the. If you go to a house where there is only fights, only this thing, the child is bound to pick up all of that. Okay, can be, okay, or the child will create a coping mechanism to handle a particular situation. So the reflection of how the child is because of what is happening there. So my another part of mother's history is the current mother's history. Now let's say you're treating a infant, okay, or you're treating somebody. So in case of this is just an example how it can be given, that affection none has during pregnancy. So during pregnancy there's no affection, feeling of, I think I shared this case in some other part of our this thing. So that is one thing. Now, when a child is coming to you with, say, runny nose or colic, most often I use mother's history, current history, even if they are not feeding, uh, when in situations like epilepsy, where there's a lot of convulsions and something that external has set aside, a series of events. So that can be an important aspect of your case taking. So not just do what happened in the past during pregnancy, but currently also. Now, let's say we're talking about a child with colic, and the child is facing chronic constipation. Okay, and the child colic was not relieved by colocynth, not relieved by chamomilla, not relieved by macphos, and this child kept on crying, kept on gnawing with pain, and you can feel if you hold the child's abdomen, you'll feel that particular guarding or the gripping sensation of the abdomen. Now, I asked the mother, what were the changes in the last few days? This can be an entry point to any case. So what were the changes and what happened that this child did not have colic 1 week back and now it has? And then suddenly she said that, it's been almost 1 year since I did not have coffee. And, I been craving for coffee. I'm a big coffee lover. I just took a little bit of coffee, and that was the only dietary changes I have made in the last 1 week. And since then, I have started to, the child has started to feel constipated. Isn't that a beautiful history? Doesn't that give us something? Doesn't that give us a clue to get us to a remedy? Where is the chat box, man? I don't know where. So what do we prescribe to this child who's got constipation because mother had coffee? Coffee, yeah? Okay, interesting. Orthopathic. Yes. Interesting, Dr. Sanjay. I would have given coffee, but if there should have been some insomnia. If there is no insomnia, I wouldn't have. Yes, perfect. Naxvomica, as simple as that. One history, everybody is prescribing the same remedy, right? Dr. Kusum got, Dr. Priyanka got it. But how did I arrive at that? Constipation. We go to nurse repertory. There is a huge chapter called pregnancy. And then we have infants in them who have colic. And then the colic, where there is constipation with caused by stimulating food taken by mother or nurse with much flatness. Only remedy Naxvomica. N gives it, and N is a Puritan repertory where it is jo hai wo hai. That is, there's only white or black, there's no gray. It's like ke sara sara. Yeah. So all of us got it as Naxvomica, as simple as that. But how did all of us get there? Case history. Give us a good case history. We can prescribe, all of us can prescribe the same remedy. You guys with me? Okay. I hope no one's asleep. So there's a lot of sub rubrics like this. Now we have something where the colic is caused grief after taking the breast of the mother who suffers from. It works superb in case of postpartum depression, where the child gets colic and non-stop colic, and the mother, if you see the state of mind of the mother postpartum, okay, it can give you a hint towards ignatia, and ignatia can help. I've helped so many women to feel better themselves, and it automatically relieves the child's distress also. Also, it's not just within the womb that the child went through whatever the mother's feeling, but the close proximity. Now, if you enter into a house where there is so much of love, you automatically start feeling love. If you enter a house, filled with, chaos, noise, and, things are very, very like, chaotic, you will not have a very calm state of mind. it will be like a chamomilla situation where, calmness contradicts the remedy itself, right? So you cannot keep a calm mind. You will end up, we are very empathetic human beings, right? So it becomes very easy for us to prescribe if we give history a very important aspect. This was an interesting case, actually. I'm going to show you the rubric in, I used this rubric where the child had convulsions because the mother had a fright situation or anger situation during the nursing period. The mother had a fight with the husband and created one in that fight between the husband. It was a very clear cut situation for me because she called me in panic immediately. And this child started getting full blown epileptic seizures where, and then I asked her what happened. You first tell me what happened before the situation. And she told me the whole fight between the husband, and then there was a situation where she shouted at the elder daughter, and then suddenly in between of the whole fight the child was seizing. This child could not bear. Again, we are empathetic. We take in the aura that we are subjected to, and this child was sensitive to that. And Bufo in 1M every 2 hourly did not get a epileptic attack after that. It was a beautiful hint to this particular case. And after that, this child, for his chronic, now again acute becomes an opportunity for us to prescribe the chronic, right? So um, the chronic remedy was Bufo because we understood the sensitivity of the child and how it reacted, right? So the chronic remedy became Bufo for him, and no seizures and no convulsions in henceforth. It was a beautiful case, in fact. I mean, I'm getting goosebumps. So this is again about mother's history, right? Are you with me? We just completed the first pillar. Boring, okay. I don't know. I don't see any chat box. I've not kept the interesting, very informative. Thank you. Okay, interesting. Please explain potency. A potency is it's a wide topic, but you should understand what is the need of the child, the susceptibility of the child. If the child is, let's say, getting affected by something dynamic around him, right? 30 and 200 will not work. When there's a situation of a blown passion of anger, passion of love, sometimes passion of, that whole fright situation, 3200 will not work. The level of this child is slightly higher because it is getting affected to the dynamic part of, the aura around him or her. So 1M was suitable for this Bufo case. So 1M 2 hourly in plussing potency or as far as possible, 4 doses through the day. And yeah, the child was okay. And then once in a while we give in LM potency when I moved to the chronic case taking. All right. So next one, very, very important observation, isn't it? Simple. Hanneman has already told, very simple. What are the things that we observe usually? Now observations, again, we have to take it with a pinch of salt. What you may observe might feel a bit normalish. What your assistant or somebody else observes is totally different. That's why we have to be unprejudiced. That is why we have to not have our pre-learned concepts. If the child is crying and because the mother took away something, it's because of course the child is going to act like this only. So for you in the head, it is normal. Maybe it's not normal for the mother, right? So you have to take this with a pinch of salt, which is normal, which is not normal, and happy or depressed, you should see that. Then what else? What are the observations? this has to be interactive, because what you observe, the beauty of homeopathy is that, what cases you get, I will never get. What cases I get, probably you might also get. But all of us have a array of cases where you might find something very, very interesting, and you have to share it with your colleagues. You have to give it a, oh my god, what, this case came, and this is how the child behaved, and this is how I analyze it, and then I gave this remedy. Inculcate this habit. There's no harm, because each one of us are trying to be unprejudiced observers. Each one is trying to interpret whatever's coming to us in the clinic, right? So yeah, so let us see what are the things on if the child is happy or depressed, if the child is irritable or calm, restless or hyperactive, child's activity, behavior of the child, anger, smile, hiding behind someone, how true, behavior of the child, silent or talkative. So now understanding all of this, the way he talks, the child mother bond, oh, this is very important. The mother is carrying the child, or the maid is carrying the child. Okay. Approaching withdrawal. Yes, Dr. Sobia, like I think Dr. Praveen Jain has given a very lovely book of his, that is Essence of Materia Medica, where he writes if each of the remedies, what is there, if this particular child is approaching or withdrawing. It means that if the child is we are able to approach this particular child for the case taking, or the child doesn't want to be touched, or examined or talked to, or even looked at, right? So yes. So this is a common setup in our clinic, which as far as possible, we should try to avoid in a pediatric situation. No child will be sitting so quietly like this, right? You will have different aspects of this child. Probably a few children, like probably Silesia, Phosphorus, Calcarea silicata, Calcarea cup, so they might little bit have their own, space. But the children right now, the kind of food they are being exposed to, the kind of gadgets they are exposed to, and the kind of miasm that is running around us as well, you will not see such, um, calm children around, right? At least I don't see in my clinic. But if I honestly pray, like, you get all soric and very calm children. Where's the child looking? No problem. So, there was this, I remember this instance from my college days in fourth year, final year, or third year, I'm not so sure. We have this passionate teacher who would teach, the remedy so vibrantly and make us understand, And that day he was talking to us about Sina. And we all know how Sina is. How is Sina? Sina is irritable, very annoying, very crying all the time, wants to be carried, doesn't know if he wants to be carried or not. If you cry and then again he will give it back to somebody, he'll again start crying. Or, want some toy, give him the toy and he'll snatch back at you. So there's so much capriciousness, there's so much irritability in this Sina child. And then towards the end of the class, my teacher told that, will anyone of you all want a Sina child in your house? Let me ask you the same thing. Will you ever want a Sina child in your house or in your clinic? No. No. Everybody said no. but like how Amitabh Bachchan says, "Galat jawab." Yes. Yes, exactly. You can. It's so easy to prescribe Sina. Please want Sina in the in your clinical setup, because it is so easy to identify them and judge them by the observations. The observation of a Sina, by the little bit of observation, differentiate with chamomilla, and you're done. Yeah. So the answer is yes. You wish to have Sinha children because you can relieve them of their distress. You know how they are triggered. Their central nervous system is so disturbed. So you can help such children. So yes, please want them. So let me tell you one case. Similarly, one case had come. Now, observations, like I said, what comes to you might not come to me, and what comes to me may not come to you. So some child came to me, and oh my God, it came to me when I was also still, a little bit apprehensive to be around children, and I was wondering if what if they fall, what if they get hurt, what if they hurt themselves, what if they put this. So you need to first be calm, right? So like the first thing what I said. So now because the reason why you have to be relaxed is because you're going to get children who you have to observe no matter what. There was this child, okay, similar to the second image what you have, like around 5-ish, takes my step, wants to do it. He wants to put it in his ear, wants to take and auscultate me. Whatever I'm doing, he has to do. He has to see what I'm doing to him. Touch whatever I am using, right? Observe whatever I am doing and see if if it is real, or what is that, I want to go and grab it. What is this? I want to go grab it. And this child also broke my torch also. I still remember. I remember this case because he broke my torch. Not because of the remedy, but yeah. It was very simple for me to give him the remedy. Tell me, what is the remedy? The child was restless. He was so curious to know what each of my equipments did. Luckily, I did not keep my, the odometer or something which I wouldn't have bought easily. Yeah. So the restlessness is there, but the whole concept is that he's trying to understand what it is, what it can do, what now stethoscope he wants to see what is it that you're touching me with. The inquisitiveness of how does this function. There was this one pen I had in my pen stand which was a little different, and it was just he just wanted to remove that and touch it and see how does it go inside and all those things. The curiosity is something that it's very very easy to again observe, right? So the moment you find somebody who has this impulse to keep touching every single thing in your clinic, think about sulfur. Most of you all are right, right? Think about sulfur. See, most of you all are right. Yes, Dr. Kusum, you correctly told that touch impelled to. Touch things impelled to. Yeah. And inquisitiveness. There should be some kind of inquisitive. Sulfur, how curious they are, how this thing. And then you can. So why I'm telling you about this particular rubric is because you can start your case from here. You don't have to start your case from bolo kya takleef hai, or tell me what's your problem, or what is your name, your age, your sex, your address. You don't need to ask all of that. You just have to start from here. Now you can ask your parent, the parents, the who's is he like this at home? What is it that he does? From there directly you're getting into the nature of the child. Now when you understand the nature of the child, it becomes easier to understand what are his fears, what are his wants, his personality, his behavior, and the prescriptions get easier. Becomes very simple for you to answer, right? So entering a case can be through observation, which is most likely the case in case of pediatric practice, because once you see how the child is, and of course, right, when the patient, I remember a case where, the child is sitting outside in the waiting area. I'm with another case, but usually when they come in, I'm just there like, hi, 5 minutes, I'm gonna see you in 5 minutes. I'm just gonna tell them so that they also calm down. This child was sleeping on the mother, so not able to keep his head, this thing is so dull, so this thing. I had a hint about it. And the moment he came, his turn was there to come inside the clinic. The moment he came and sat in front of the chair, he just put his head down. And he just, I just want to, he was so dull. He was like, he can't keep my head on. I don't want to keep my head on. Like, I just want to be around my mother. I don't want to. And immediately I started him off with Jayasingh. The moment, this thing came, I started asking the same questions according to that. Mother told, I asked, is he dull like this? What is happening? Then I get to know that he has fever. So first thing is the observations, what you see, right? So subjective symptoms can be elicited little later, no problem. Give utmost importance to what is objective and is there, right there in front of you. So yeah, that was the I think I'm giving you too many cases, no, in between. I stick to the PPT. Okay, one more case. Now, this is also very, very common. Now, commonly you will see there was a child who very observant, similar, where the child was not actually so mm, cranky or restless or anything. Child was calm. They had a smiling face. The child was very, fair and very how do I say? He had sharp features, and the child was quiet but very, very, very observant. Okay, the child saw everything I told, everything I tried to do in the clinic, and the child was just curious. He's just curious about what exactly is doing. It's so much so that the child did not open the mouth. The child just wanted to. You just clinged on to the mother, and some when the child was given to me for present auscultation and examining everything, the child was just looking. "Acha, theek hai." And then I put the nose and the torch on the mouth, and it's just like looking at the torch, and then he gives it back to me. So that was the thing for me to prescribe on, right? So the child was so watchful. I went to the other side of the clinic where I keep my mother tincture. So child was having a look. What am I doing there? How am I putting the globules? How am I making the medicines? Every single move was monitored. What remedy was it? All of us will get it because this is very, very characteristic, right? What are the remedies? Perfect. Perfect. Every one of you all have said the same thing. That is phosphorus, right? This is the goal, right? Now, it's possible because I narrated to you the rubric language or narrated to you how it was. But my humble request is to get watchful yourself. Be a bit like, phosphorus, because the watchfulness will help you to elicit. One of the key things in pediatric practice is to be watchful of what your child is doing while you are taking the case. So you need to multitask in between asking your parent that, this is the what happens if this happens, did the child have this or that, while you are having another eye on the child, how the child is behaving, what you can grasp from the child themselves. And you will get so many minor things from them in terms of your clinical analysis, your case analysis, and your remedy analysis. So yes, watchfulness, if you can understand watchfulness, children are on the lookout for every gesture, everything. And watchfulness, movement in the vicinity or every movement of the doctor. So in the repertory, we have things stated this way because our clinicians have seen it in the practice as well. So utilize it to the maximum. So now that you know that this particular thing is there in phosphorus, you will go back and, okay, probably if this is happening. Now, don't think that everybody who is, watchful, you give them phosphorus. No, make sure there are other things. When I took the case history, it becomes very easy. Dr. Karishma says, I thought of phosphorus, but there was no, I was not sure because not seen this presentation of phosphorus. So each one of our remedies have beautiful representations, right? So it's actually fun. I remember a day where, I have given phosphorus to 3 to 4 different in the same very day. I don't know, it was a phosphorus luck, or I was being lucky enough to get all phosphorus symptoms, and all of them were totally different. They were like, either one child was very, very extra punitive, very extrovert and talking and very vivaciously talking. There was another child who was very, very reserved and didn't want to talk. And then I saw that the child was hugging the mother and non-stop. The mother saying that she's such a good child and like that, and she would kiss the mother, and it was a different presentation. The phosphorus people can be also very, very angry, so it depends on how your analysis is, and go through the rubrics of each of the remedies in a very open mind, because phos can be this way as well. They can be very extroverted also. And if you see in the repertory, go under the rubric reserved, they come as 3 grade, I mean higher grade marks for phosphorus. So yeah, you can think that phosphorus is not just a very extroverted and very happy person. They can be reserved and observant and watchful as well. Clear, Dr. Karishma? Are we good? I have to finish the pillars at least today. My God. I'm very talkative. Okay. So another part about in pediatric practice is something, I'm not going to talk much about this, but I'll just give you a hint. If is the anthropometry. Anthropometry is when you check the height, the weight, and the arm circumference, which is very important in India, and because if you're seeing the low socioeconomic classes, you need to know that there can be PEM, that is protein energy malnutrition. So if you are seeing such cases, it becomes very important for you to do an anthropometry. Right? If you need to keep the height and weight and the measuring tape, and there is calipers that we do the head frontinels and things like that. But on a general practice note, my if we have to see in the more materia medica and repertory language, how does the child look? And that is also very important, right? Is a child emaciated? Is a child having a particular kind of obesity, having a particular kind of emaciation, right? So we can also be very, very vigilant about how the child looks, not just the behavior, but objectively how the child looks. Does the child have, teeth that are, not placed properly? The child has caries in the teeth. The child has bowing of the legs, hinting towards rickets or vitamin D deficiency. So observing the physical aspect of the child, the build, the nourishment, gives us the hint of the, what the mother or parents are not focusing on, and we can advise them according to that, right? Now, coming to the homeopathic part of, we see the different builds, right? What are the common things in our materia medica we see? You would have read remedies, no? You would have read remedies about how the child looks. I'll give you one question, you have to answer that. Emaciation though eats well. What remedies come to your mind? What all answers will come now. Fast. What remedies come to your mind? More people, more. I want that full as up. All of your answer. That's right. That's right. Iodine, we have natrimure, we have cinna, we have abrotanin, sanicula. I love this answer. Yes. So everybody is awake only then. Summary is that. So you have to answer. What are the other things we have to observe in the child? Emaciation is one important thing, especially in India, if you're seeing children, because it was very important. Oleum Jekyll is very nice, Dr. Soubya. So in our repertory, we have the lower part of the body. If the lower upper part of the body or the lower part of the body is affected, if it is upwards, emaciation that is ongoing, it goes from below upwards, or if it is descending, right? So if you explore the materia medica, it will give you hint how to ask and how to observe also, right? So what are the remedies that whose things go upwards? What are the remedies? Leaden. Okay. And okay. Abrotanin. One more remedy. So everybody is awake only. Good. What is the remedy? Calcarea phos. Very good. I'm talking about upwards. Below upwards आता है उनका emaciation. One is abrotanin. That is correct. One more. Argentum nitricum is another remedy. Which remedies have lower part being emaciated? Lower parts are emaciated. Calcarea and natrimure is one. Other ones? Which is from the plant kingdom. Lycopodium, yes, Dr. Soubya. Sanicula, yes. That's right. One from the animal kingdom so that they don't feel bad. Don't make the animals feel bad. One from the animal kingdom. Anyone? Cenchrus. Cenchrus. It's a Ophidia. It's a reptile. Okay. So emaciation, there's so many sub. If you open Fatak and see that, what type of, again, your case history will depend on what remedy you have to give, right? So if you see the descending that goes, ऊपर से नीचे, or that goes, sorry, lower part to the upper part. Am I right? No. Am I confusing you? Ascending is abrotanum and argentum nitricum, what I just asked you all. Descending is what? Lycopodium, natrimure, sanicula, and sarsaparilla. You can add calcarea phos and even cenchrese to this. This I'm talking from the Patak point of view. So that is one type of emaciation. If it is too rapid, we can think of thyroidinum as one of the key features as an intercurrent remedy, which will improve the nutrition and the basal metabolic rate of these children. So give thyroidinum whenever your child is having delayed milestone, not able to put on weight, history of mother having thyroid, if the basal metabolic rate is slightly on the lower side and, it's moving towards obesity, do a check and see if you can think of youth. Usually children will suffer from youth thyroid, not full-blown hypo or hyper. So think of it. So this is again observation. So What if they are obese? We know calcarea is one of the most obese children in our materia medica, but they are also, capsicum is something which we usually forget in pediatric practice, but I love using capsicum because they are, I've read them like how we read Sina. So open if you want, I think you should, if you get this small booklet called Borland's Materia Medica, Borland, Borland's Materia Medica, just have a read through the types. He classifies remedies into types, so read that little bit in depth and you might understand some newer aspects of the common remedy. Okay. Now, fat body and legs are thin, ammonium nude. That is also very, very commonly seen in the practice as well. So my take home for you is observe, observe, and observe. There's an ocean of observations that each one of us have, because each one has a keen eye, but slightly differently. We as homeopaths give individualization so important. We as homeopaths also are very unique. Your cases, your observation eye can be totally different from mine. So don't underestimate any eye of a homeopath. So have a keen eye and observe into your cases. Then, so we have finished mother's history during pregnancy, then we have observations. Then very commonly what we see is the milestones, right? Now, milestones, how do we know that, there is a delay? Milestones becomes something where you will base your prescription on only if and only if you know what a normal child is, right? So if you know the normal child's growth and development is only when you will know what is slightly hatke or delayed or precautious or offbeat basically. So the normal child, so it's just not the development, Dr. Sandhya, but the growth and development in general has so many aspects of it. It's firstly the physical, the gross motor development, fine motor development, language and social adaptability, dentitional. So all of these come in our growth and development of the child. This itself is a huge chapter. I would suggest we do another session if you want to, but understanding this is important. From infancy to the first year is very crucial, because what we are, today, I mean, in adulthood, depends on how you were in your childhood, especially the first 2 years. Yeah. So if you're dealing with way too small infants, when there are frontanels are way too slow in closing, we read these remedies as sulfur, silicea, calcarea, and calcarea phos most importantly. So calcarea phos is a beautiful pediatric remedy which works in different aspects, be it constitutionally, be it supplementally, like in form of biochemic remedies, or in different other, like I think they have different forms right now, but I use it immensely in dilutions of 30-201 m and 6x potency for my children, and they respond really well when indicated. We can have walking delayed if they're too late in walking, and talking as well. And now before talking comes in, that is a dentition. If the dentition itself is slow, or if the dentition itself is difficult, the talking cannot be established. So you need teeth to we use the teeth, the tooth, to have our pronunciations, right? So first comes the dentition, and then we will think about what is talking. So if you see in most rubrics, we will see calcarea being one of the key features here to, in cases of delayed milestones. So don't abuse it, but see if you can individualize it to different remedies. Silesia also works very well when there are bone deformities and bone abscesses. There was a child, I remember, I can still, feel that I could feel, the mother's plight, because the child had an abscess in the in the bone, in the femur, and it was treated, surgically treated. Child never well since then, and I gave Silesia. It was beautiful. The child started walking also towards the end of our treatment. In a very small child though, who hasn't developed walking yet. So just imagine, the bone structure is been targeted in the very young age. What can be the plight of this child in adulthood? So start early for all the children so that they can have stronger bones, stronger immunity, stronger responses to different stimuli in their adulthood. Then cost is one of the major thing. Here, I want you to just have a look at this rubric where development is arrested. This is very useful in delayed development in GDD cases, where there is global developmental delay cases, where you can see in early ADHD, ADD, and autism MR cases, where the children feel, the mothers feel that, they are not able to push. It's been so long from this milestone to this milestone, we are not able to push. Intercurrent can be one of the sarcode, that is thyroidinum will help very well. Another one is malandrinum, but thyroidinum helps very well in cases of, when the children's development is arrested. Also, towards the adolescence period, we can think of having delayed puberty, and if that is not achieved, also there will be a lot of other hormonal imbalances in their adulthood. So that is also, if you see, too early also can be puberty, too early, that is precocious, can be too early or too late as well. Clear? You with me? I've eaten so much of your head. Okay, so we finished mother surgery during pregnancy, observation, very important milestones. Last but not the least, I've summarized it to be as immunization, because in this current time and day, we are subjected to more than what is required immunization, and it's a controversial topic. I'm not going to talk please don't ask me question if we should immunize the child or not. It is a controversial topic. If your patients ask this question, make sure you tell them the benefits and the demerits of vaccine. If your point of view, you tell them, but it's their informed decision if they need to vaccinate or not their child. So that is, be careful. That's all. So vaccination ill effects of, have you seen any case where post-vaccination there are some problems? Anybody? No. Okay. Only one answer. No? Rash, fever, pain, crying, itching, autism after MMR. Fever, rash. So fever, rash, and pain or crying of the child, very irritable. Also, even breathlessness or asthmatic attack after vaccination is very, very common in my practice. But when I was practicing in the pediatric ward in my government homeopathic medical college, we have seen time and again that we have had instances where we could bring that ailments from vaccination to many, autistic children, mostly after the third year vaccination that includes the MMR. And that was one of, we treated them really well with a good amount of individualized remedies, but uh, a detox sort of a thing, we can think of some of the common remedies here. Um, like I said, there was this, if you could just as a homework, just read melandrinum as a remedy. It is available in many books, melandrinum. It's a nosode. And just read this particular rubric. I remember a case of similar autistic child who I think got after vaccination, and I started the case with melandrinum and the indicated remedy followed. The behavior completely changed. This morning, I had one case of autism child actually. So the autistic symptoms started when the child was 5 years old, and I have used um, the indicated remedy along with the indicated nosode. Without a nosode in such children like autism, MR, cerebral palsy cases, without a nosode, it is very difficult to use, find much, improvement. There will be roadblocks, like how we started the session. There will be a lot of obstacles to cure, but make sure you use nosodes intermittently so that you can see a difference. So this morning I gave my case medorinum as one of the remedies, because if you I think you can just in that also there was observation, the history of the mother, and recurrent urinary tract infections during the pregnancies. Not being neglected. The child wants to hide. The child is very psychotic. So many other aspects. I have given medorinum, though it is not given here. So if you could just, I'm just gonna reshare my. Do we have time, Dr. Mansi? We do have time.
Yes, yes, ma'am. It's 3:33 only.
Okay. Okay, I'm not. Do we have time from the participants? Are the participants okay? Or I told 1.5 hours. Will you give me another half an hour? Okay, good. Thank you. I just, out of the PPT, I'm just going to tell you about this case because I've missed using this particular as the observation chart. One of the easy to observe in the clinic. This particular rubric is very easy to observe. That is teeth serrated. Okay, and medorinum has lower mark, but depending on the individualized of this particular case this morning, the autistic child, I have given medorinum as one of the intercurrent medicines for, because the child is doing well now. The child has reduced the behavior patterns. He had different patterns, like he would play with his penis in his the public, and he would find pleasure in that, wants to go alone and sit and play with his penis. He doesn't understand it, but he's just doing it. And we are working on the speech of this particular child now. This is one of the hint, is not the only reason why I prescribed medorinum for this child. One of the hint that again includes us to observe the child. So if you see the teeth being serrated, there will be too many grooves and ridges through the teeth that can give you a hint towards nosodes like syphilinum and medorinum and basilinum that can give you an intercurrent for such cases. Also, constitutionally, tuberculinum and sulfur or lachesis or plumbum So yeah, so that it should be one of the somewhere in the back of your head you keep that probably the next follow-up I'm going to give this intercurrent in our follow-ups. Everybody awake? Sorry, I didn't stick to my PPT. So are you finding it a little easier to understand how to approach a case? Is it possible for you to approach a case without getting scared? After all, pediatrics is so cute, no? Like the patients are so cute. The patients are just, they don't have any, negative, like, they've not lived much life. So you'll only find all cute stuff. Their only problem will be that the toy is blue in color and not red in color. So it's so nice. It brings us to, touch to our child, the inner child within us. Yeah. Dr. Sanjay, yes, I have used bowel nosodes, but my experience with bowel nosode is not too vast, so it's not right on my part to comment on it right now. But yeah, I think we are using Decentrico and Morgan Pure a little bit as an intercurrent. Uh, Mostly, maybe when I learn a little bit more, I'm still exploring, so I can talk about it. But yeah, so main pillars in pediatrics, just to summarize what we've just gone through, is mother history during pregnancy, observations, we have milestones, and immunization. So easy way to remember, we need mommy. We need mommy to get your kids right, and your pediatric practice can get better with mommy. So we just need mommy with us and things will be fine. So don't get scared. Pediatric practice is very, very simple. It's not something that you have to get scared of. It is just white and black. There's no gray area. So utilize it to the maximum, right? So yeah, so I think we've covered the major chunk of today's session. If you have any questions until now, please reach out to me and I think somebody unmuted themselves. Interesting, na? Possible to do. You and I, both of us can do. All of us at the same remedy. So if you take the case properly, which nosode is good for GDD? Depends on your case. But yeah, if the nutrition is not getting, like, if the nutrition is not getting adequate, if they're not able to break that, so you're giving me giving a pointer towards me suggesting towards, giving a nosode in between is that, when you are on a homeopathic treatment with the children, you will see that when you're treating GDD, global developmental delay, what happens is after one point of time, you will find there's a stagnancy in the case. You will see that, initially you prescribed and, the child started talking, the child started walking, but then, the next milestone, which is slightly more difficult than just physical, there should be a mental will and the nutrition to support it. So what happens is the nosode will break that. A nosode can help in, can act as a catalyst to what indicated remedy you're giving. So it can be thyroidinum, basilinum, or tuberculinum, anything, but the timing should be right and also individualize it according to the particular case in hand. But yeah, thyroidinum helps. Thyroidinum helps in case if it is arrested. We have come to a point and then it is arrested from there. I think we have a hand raised.
Dr. Sheetal, this was a wonderful, wonderful session with great information. And I have to say, this was also delivered very beautifully. with so much of enthusiasm, and you did manage to keep us engaged and not sleep and not need tea or coffee. I have another engagement, so I have to leave. But thank you so much.
Oh, okay. You're gonna miss the cases. I thought I'd share some cases.
Would we get a recording or something? I'd love
I don't know. Dr. Mansi should tell me that.
Yes, you will get it will be uploaded on the YouTube. We will
It
get
would have been wonderful to, see the cases also in person and maybe interact. But unfortunately, I have another commitment.
No
So it's
problem.
the same, I have to leave, but thank you so much.
No problem. I'm glad you had a good learning experience.
Yeah, enjoy your sharing with the same enthusiasm. Thank you so much.
Okay, shall we move forward? I think break ho gaya. Are we okay with mommy? Okay, shall we move forward? I was very. Okay, so few cases before we part our ways until next session. I won't take much of your time. Yes, do I have a thumbs up from everybody? Super. Done. So I'm gonna put simple cases, okay? And I'm gonna give clear-cut observations, clear-cut case. Of course, I took half an hour, 45 minutes, whatever. That is my headache. But I'm just making it a little more concise and giving a few words and understanding of each case. You just try to guess the remedy. Guess the rubric, guess the remedy. Fair enough? Fun? Okay? Quickly, no time. Say yes, then I'll move forward. Dr. Mansi is forced to unmute and say yes.
yes, yes, ma'am.
Okay, cool. So here's a case of a child, okay? A child where very naughty, very inquisitive and high of energy. And what is the observation you have on this photo I have put? Observe the photo, whatever I have put.
Ma'am, the slide, it is immunization slide is showing.
Oh, really?
Yes.
Oh, goodness, I was talking. How do I unpause this? Oh, God. I was talking to myself so long ago. I mean, I was talking to you, but without a reference. Is it possible now?
It's not yet visible.
Now?
No, ma'am. It's showing that you have started screen sharing, but nothing is coming.
It's coming as screen sharing is paused here for me. Now?
Yeah, it's showing main pillars.
Oh, okay, good. Now
Oh.
we are. Now it's come. Okay. No, it had got paused. No problem. Okay. So we are clear till mommy, right? Yes. So
Yes.
let's do some quick case examples. So my understanding is you are awake, and I trust you are not asleep. Uh, and I'm going to be very interactive. My chat box is ready, and just be very interactive because you have to make sure I don't sleep. Okay. ठीक है. So what is the observation you have with this? Okay, so I was telling there was this child who was very high in energy, very like jittery uh, and the thing what the mother said was this expression, whatever I have tried to portray. See the right top and bottom below and observe. Tell me, what is your observation? Okay. Dr. Sanjay has got it right. Joy in destruction. The child is breaking, and is very, very happy about it. Mummy, dekho, mummy, look at this. Break. And he's like, Ati, I broke it. Like, So it's the joy after destruction, right? So what is the remedy? Single remedy rubric. Quick history is that we are treating this child for recurrent urticaria, and the child is actually, I've got this particular rubric in so many cases, and I've utilized this multiple times. I'm just going to give you a easy understanding of one of the case. Recurrent urticaria, child blows into a full-blown urticaria whenever there is slight change in the immune response, and there is extreme joy when there is destructiveness here. The child is active generally, very talkative, very, very high in energy, cheerful destructiveness with spongia. Okay. Then think. Bring your thinking caps on now. The next few minutes. I'll take another 5-10 minutes, and then we can explore some Q&A. Yeah. No, Dr. Shamika. Tuberculinum. So I gave tuberculinum. I have given I felt that this child was from animal kingdom, so I have given that lachesis was given in between because of the emaciation I observed, and I gave Sencris also, but no help. Child kept getting. So kept looking back, I reanalyze, understanding what, but this destructiveness, cheerful, I never gave importance on. I never gave importance to the joy of destruction. Any child, no? This is again this unbiased observer situation. Any child will feel happy. Any child will, whatever they are finding happiness in, it's okay. I'm okay. Like, why should I give importance to that? Then something beautiful happened. I saw break things desire to laughing about it. Single remedy rubric Apis mellifica. And with Apis, and we know how Apis is so beautiful for urticaria. I just gave him Apis. After that, that's it. Closed chapter of this Apis. But this case made me learn this rubric, which I have used multiple times for many of my cases. I want you guys also to use it. Whenever you find a child who is, of course, make sure everything else also matches. Okay. But, don't miss this. It's very nice. I missed it multiple times, so I don't want you to miss it. Please use it. And if you use it, please email me back and tell me that I saw a case. I will feel happy. Then my circle is full. Next case. Okay, fine. Next case. Only 3 cases I will show. Then we can leave. I think most of them have exited also. Now, there's this child. Again, we have a restless child. I mean, I don't think I get a non-restless child in my clinic. Fine. So we have a restless child. This child has crossed the bedtime, the timing of hunger. Then we have this child so cranky and Dr. Arpita says we will be more helpful if the potencies are unenveloped. I love the way of using the uh, words. So let me just tell you about EPIS. So when potency is involved, when I'm basing it on the state of mind, I will go for a higher potency. So if you could see Dr. Sankaran's levels of, the different levels, what he says, and let me see if I can find out that a PDF and share it with you guys. It is the most easiest way to understand potency. So if there is a pathological symptom, okay, Dr. Mansi, we are back a little bit again because somebody asked about the potency. Okay, so if there is a physical level only. Now, for example, in this case only, like if they're treating only urticaria, and if it was like this only big urticarial boils, which is inflamed and red and burning, stinging, acute situation, I would have not thought of anything but given APIS 30, right? You and I, both of us would have given APIS 30, agreed with me. So at that moment, we are sure that the child is going to feel better and gets immediate response. Now, when it comes to understanding the whole behavior, now let's say if you are uh, going one step higher, once the pathology is established, once the pathology, then next we have the state of mind being a bit more evolved, and the patient is how do I say, presenting themselves with a far more stronger symptomology or the expression in the dynamic level, a pathological prescription will not do good. Like I told you about this Bufo case, were you, the Bufo case? Do you remember the Bufo case? I'm not so sure. So in that Bufo case, I gave 1M because the child was affected by something dynamic and responded in a different plane. Now, central nervous system, epileptic attack, affected by fear, fright, anger. And then we are having a situation where, the child is seizing continuously. A 30-200 will not work. So I need 1M for an immediate situation to get me under control. So potency is a big topic in itself. Let me try to, I think Dr. Mansi will have that PDF. I'll try to ask. There's a PDF by Dr. Sankaran itself. I follow that wholly, solely, and it really helps in my practice. I'm okay with sharing. You can just email me on, and I'll take it from there. Sheetal@happyhealing.co.in. Okay. Then, okay, next case. Quickly. Sorry. So I have this restless child in the clinic, extremely hungry, pissed off because meal time is gone, wants to be held by the mother all the time, wants to hold the mother all the time, chippo moment, okay? Restless when not given food, and starts hitting mother if there is a delay. So this was, the child was, I'm so sorry. Okay, so the child is, the reason why I'm telling only this part and not the presenting complaint of the child is because, again, this was the observation I picked up in the clinic, and from this I entered into the case. Now this child was brought in for various other behavioral issues, but this was the clear-cut thing in the clinic. It was late, it was post-noon, hungry, and starts hitting the mother, starts shouting, screaming, and wants to hold but hits the mother, hitting the mother, and which is something not okay in my heart. Like, I was a little bit like, is this what he normally does? Is this what your child is doing regularly? No, doctor, no, only if, I only if, sorry, Only if he's hungry, no, only in that time he's gonna behave this way. Not He's not all the time less. Other time he's restless. He's not doing anything by himself. But only when he's hungry, he gets really like, I don't know what gets to him that he starts hitting me and he gets very, very restless. So that was something very big, this thing. Then I entered into the case. What happens? How is his appetite hunger? Is he able to assimilate well? Is he able to have a particular set of food habits? Is he asking for what kind of food does he like? Desires, aversions, and everything. I started asking. So the entry to the case was again from this, from the observation. So we started case from this. Then I get to know that the child is addicted to what, you tell me, sweets, and he wants the and in India we get something like, how do I say, candy, which stays in your tongue for a longest time, which is always, it doesn't dissolve fast. That I don't know what's it called, but it's this candy that, yeah, yes, Dr. Sobia, that's right. So then I get to know about this. So slowly, one after the other, I unravel and unwrap to understand what the child is. And if you go to Dr. Sobia, you're right. What is a rubric? My attempt is for you to utilize my only reason to ask you that is to utilize what is available to us in the repertory form. We can use repertory in many ways. Observations are it's fun to see how we can we find this observation in our repertory. Can we find this? Just try to understand that. So what are the remedies which we think of? Sulfur is one remedy that we can think of. Anger, sweets, aggravation. No, the rubric should be anger, fasting, aggravation, because I told you it is because of the hunger. Right? So rightly said by Dr. Sobia, I gave saccharum album, saccharin. You have to see in different material medical have different things. So hunger, striking, so clear cut. No single remedy rubric. Two are there: striking, hunger, fasting, aggravation; violence, vehemence, hunger, fasting, aggravation. Good. And then the other option: holding or being held, desire for mother's hand. Clear cut saccharum album. This is one remedy which, if you understand it and pick it up in your pediatric practice, you can solve many cases. Have you used saccharum album in your practice? Not yet. I love Dr. Prachi's answer. Yes. Now you can utilize this and okay, I don't know why it's a little bit of saccharum album. Is that okay? Saccharum officinal or album, right? So if you see in the Boric Metra Medica, it says that according to Dr. Herring, a large proportion of chronic diseases of women and children are developed by using too much sugar. The reason for me to share this remedy with you guys today is because the uh, the widespread use of sugar in our current generation And saccharum, though sugar can be used in various forms, but this can be a very good tool for your uh, uh, cases in the future. Sugar is an antiseptic, combats infection, putrefaction, and solvent action in fiber and stimulates secretion of intense osmotic changes induced, thus rinsing out wound and serum from within outward, favoring healing. So in ulcers, it locally, I think so, it is a very good antiseptic. But take it with a pinch of salt, where we can think of it in children who are fat, bloated, and large limbed, like our like a calcarea cup, like a chamomilla, or even capsicum, we can think of. So they are cross, peevish, whining, capricious, want dainty things, tidbits, and refuse substantial food. So the food part is not, it's a false plethora. The fat and bloated is the false plethora that they are going through, right? There's so much, I'm sorry, so much craving for the chota mota items like tidbits, like snacks, or in my niece and nephew, when they asked, "Do you want to eat anything?" Like, no. But are you hungry? They said yes. Then what are you hungry for? I have a different kind of hunger, they say. Dusra wala hunger, they say. Dusra wala hunger means that is a different hunger which they want only tidbits and dainty things for them. So this is for the children who are always in their other hunger, where they will not eat your dal rice and sabzi. They will only eat junk if you give it to them, or something sweet and small nicks and knacks to munch on. So if you read Saccharum in various books in from the repertory, you will find a array of symptoms and understanding of a child picture in which will come to you in the clay. So the peevishness and the cross and capriciousness is similar to Sinna, and we can, like most of you suggested also, except for Dr. Sobia. So if you read up, there's so much anger. There is so much anger, and the temper tantrums they throw are also because if you see a child after he's had a cake or an ice cream, just observe them, how they respond, because there's so much high of energy in them that it's very hard to handle them. Now, very good usefulness in autism and mutism. Break things desire to fasting aggravation. So when they are the same like apis symptom, like break thing desire to, but they are very, very like Sina type, but they can also be clinging to children of mother too. Takes the hand of the mother will always, who always wants to be around family and friends. Sleep with parents, child cannot sleep alone. So if you understand it in its personality, you will love, to put one more remedy into your bank of Medina America that's going to give you like your bread, butter, biryani, pasta, whatever you want. So do not miss this remedy. And I think we have crossed our time. But my main goal was to give you a confidence of, having the having mommy with you. I just want you all to have mommy with you, and utilize it in your cases. I want you to reach out to me whenever um, you might be having issues or doubts. I don't mind. So are we good? Instead of sugar, baby takes chocolate. Can we give saccharum album? Yes, but the same vehemence, same sort of, um, uh, the anger and these things, should be there. Then only you can give. I have prepared too many cases, I think. Okay, so So we've had a lovely session. You can reach out to me and tell me, please give me your feedback about how you liked the session or did not like the session. I think I took it a bit slow today, but the only reason is that I wanted to be ingrained in you how we can make the best out of this thing. So you can reach out to me on my email at sheetal@happyhealing.co.in. Sorry, this is mistake. .co.in, and you can follow me on Instagram, Facebook, X, Threads, wherever you want to find me. Catch me, I reply everywhere. Email is the best place to catch me. So here's the thing. I would like you to I want to give you a small homework to read thyroidinum and malandrinum, which is very important as well, along with saccharum album. If you can do a small read up, that would be also great. And send me a feedback on my email ID after reading these remedies, so that I know that someone has read. At least one or two have sent me one or two of you have sent me an email. I feel happy that yes, these 2 hours has been worthwhile. So any questions, any homeo books to sharpen our observation skill? Repertory. Repertory is the best book to sharpen your skill. Do one thing. If you want to sharpen your skill with your observations, just sit with the repertory whenever you're free. So I love SHS and I just sit, keep browsing. I'll open the repertory, open the sub rubrics as well, so that I can just see what is there where. So the mind will look for things only what it knows it is there, right? Like this particular rubric is it, then you search for it. If it comes to your clinic, if you do not know that this particular rubric is there in a Materia Medica or repertory, you will not search for it. So in your free time, just go through the rubrics. I think they are, I don't know, it's your bread, butter, biryani, pasta. don't don't neglect that. Had a case of 7-year-old child who loved traveling by bus, only bus, no other vehicle. Which rubric, madam? What? I think there should be a why only bus. I think that should be here. If I don't think it's only the traveling part. Is it the sociability part that they can move with other people? There are a lot of people in it, or the openness of a bus, or the AC of the bus, or the comfort of the bus, or just the movement of the bus, the cruising of the bus. That is it that. So you can probably ask what is the thing, but Calcarea falls tuberculinum can help with uh, uh, if there is a need to prescribe. Otherwise, this can just be a trait and you can just let it be. You can still take it as love for traveling. Even if it is just by bus, it's okay. You don't have to be so stringent. If the child doesn't love traveling, even bus cannot happen. So if that essence of travel is there, you can think of all the traveling remedies, your tubercular remedies that will help you out. Thank you, Dr. Arpita. I think you've been Dr. Some of you all have been very, very attentive, and I love that you have been very attentive to the case, to the session. You kept me awake and not sleep. Thank you.
Dr. Sheetal?
Yes, Dr. Ashok Madan.
Ashok here, Ashok here. I have to maintain my emotions after your lesson.
Okay.
Already the lady doctor have told many things about your lesson, about your way of teaching, whatever it is. It is really fantastic. Believe me, I have to still retain my emotions, that how your expressions, not only the informations, not only the right teachings, the observations, everything is, but way of your expressing very slow, that it will enter to one's mind anyway, by all means. Thank you very much. And I'll be wanting the email. Either I will ask the office, Asmita, or you can chat here, so that in recording, I would like to ask your permission to write a case just for
Sure.
understanding the case, you know. It's not for question of only remedy. It's a question of to understand
Sure.
that
The
child.
email is on the screen right now, sir. You can reach out to me there, and I shall try to respond to my best.
All right, all right. Thank you very much, Dr. Sheetal. Fantastic, really believe me that. I must say, it's good wishes for your teachings. Good wishes for all of our student doctors who are listening. I hope they have really enjoyed. Thank you very much again.
Thank you, Dr. Ashok. Thank you so much. My pleasure.
I hope that Dr. Preeti will reorganize another part too, or to go on to have more sessions for the children, you know. I have listened, Dr. Praveen, he's master of that. But the way you told the things, thank you very much.
Thank you so much for staying till the end, sir. Thank you.
Okay, thank you.
Thank you so much, ma'am. It was very interesting session. And yeah, we look forward to work with you. Yes, to have more
Yes.
sessions. Sure.
Yes, sure. We shall see if we can do something more, and we shall see how
Yes.
if it can benefit all of us get benefit.
Yes, yes, yes.
If you have any questions, please drop in the chat box so that we can assess it. I know it is way past the timing. I don't mind spending another 5 minutes if there are any questions with regards to case taking for now, and then we can explore more in depth later.
Yes. So any other questions from the participants? If you have, you can just put it on the chat box.
Lovely. It's been very it was a very you know, close to my heart session with musings here. And thank you guys for being such uh, supportive participants. The screen not working, the shares not working. But yeah, I think we crossed all the hurdles to cure, and we had, I think some of you all have benefited with it, and that makes me happy. So thank you, Homeopathic Musings, for you know, giving me this opportunity to connect with everybody.
Thank you. Thank you,
I'm
ma'am.
looking forward for everybody's feedback. So please initiate that.
There is one feedback that waiting for part 2, 3, and 4. It's something very nice.
Thank you. Thank you so much, guys. Hopefully we're able to connect back soon for the following parts. And yeah, I think we can come to an end for today.
Yes, yes. Okay. So let's meet on Homeopathic Musings platform. There will be every month, there will be on first Saturday, there will be a free session, and Homeopathic Musings has a lot to offer. There will be a link on the chat box for the course details and everything. You can just reach out to us if you want registration or any of the things. Thank you. Bye-bye.
Bye, guys. Nice seeing you all.